Medical tourism. Medical tourism is when a person travels to another country for medical care because of various reasons, which we'll discuss now. Because of cost, culture, and unavailable or unapproved procedures. Most of the time, cost is a factor. A medical care in their own country must be very costly, not affordable. They go to other developing countries to get the same treatment done in a very uh, inexpensive way. Culture, some because of some cultural factors, some treatment cannot be done in certain countries, so they may have to travel to other countries to get the treatment done. Unavailable or unapproved procedure, for example, in developing countries or other backward countries, underdeveloped countries, high-tech solutions may not be possible for the citizens there. So uh, if their lives are at risk, they may have to travel to a developed or undeveloping country to avail the treatment. So the most common procedures that people undergo on a medical tourism trip includes dental care, surgery, cosmetic surgery, fertility treatments, organ or tissue transplantation, cancer treatment, etc. These are the most common procedures which is most sought after in medical tourism. Medical tourism can be risky in case of infectious disease. In certain countries, because of their endemic rate, certain infectious diseases are more prevalent. And if the patients seeking this care are not properly vaccinated, they are prone to getting any infectious disease, or they are prone to get any healthcare associated infection during their hospital stay. Antibiotic resistance, they may have been following a certain antibiotic regimen in their own country, and during the travel and even after reaching the receiving country, they may continue with the same antibiotics. So long term use of antibiotics will lead to antibiotic resistance. Quality of care may vary from country to country. The perception of quality care from a person traveling from a developed country must be different as compared to the underdeveloped country or developing countries. Communication challenges, especially when language barrier is an issue. Usually, if it is most commonly used language is English, but if the people coming seeking medical tourism are from the countries who do not recognize English as a official language, in such areas, communication becomes a challenge. Air travel may be a bit risky when you are carrying a high risk patient, or you are transporting a high risk patient from one part of the world to another part of the world. Continuity of care is a bit difficult because after discharge, the patient may have to go back to their own country, and to keep up with the telemedicine and other continuity of care is a bit difficult. So these are the areas where medical tourism becomes risky. Factors affecting medical tourism. High cost of medical care in developed countries is one of the reasons why most of the people from developed countries wish to seek medical attention from developing countries, where they get the same quality of care but at a much less rate. Long waiting time for operative procedures are seen in developed countries, and to overcome this issue, they choose for medical tourism. Because in India and all operating, there is not much of a waiting time when it comes to operating procedures. Affordability, accessibility, and availability of international travel had made medical tourism very easy. Improved healthcare in developing countries. As compared to developing countries, certain hospitals, certain tertiary care hospitals are at par, comparable to the hospitals in developed countries. Scope of travel with medical care. The people who require medical care from certain countries, they do have a special assistant from the government also to travel for their medical care. Developed tourist industry in India and other developing countries at affordable cost. The tourist industry in India is developed, and also it is at a very much affordable cost. Medical tourism for knee joint or hip replacement is the most common uh, sought after procedure in India. Medical tourism providers have developed as intermediaries to unite potential medical tourists with proper hospitals and other organizations. Medical tourism providers, they necessarily do not have hospital, but they are like the intermediaries when it comes to selecting the patients and providing and linking them with appropriate hospitals. Thank you.